Hello and welcome to Feedstuffs 365. I'm Sarah Muirhead. Change is coming to how livestock producers access some antimicrobial products, about 91 products to be exact. U.S. Food and Drug Administration guidance for industry number 263 has medically important antimicrobial drugs moving from over-the-counter to prescription status by June 11th, 2023, so this year. Here to walk us through how best to plan for a smooth transition is Dr. Mike Lormore. Dr. Lormore is head of U.S. Cattle and Pork Technical Services at Zoetis. Welcome, Mike. Thank you for joining us here today.
Thank you, Sarah, for inviting me to be here. Look forward to the conversation.
So let's start by having you kind of set the stage for us. Give us some general understanding of GFI 263. What is this new guidance all about?
Yeah, I think one thing that everyone needs to keep in mind right up front is Guidance 263 is really part of a long effort that FDA and the Center for Veterinary Medicine have put in place over the last 10 to 15 years to support stewardship of antimicrobials that are medically important to humans and are also used in animal agriculture. This is really part of the latest 5-year plan to ensure that drugs are used judiciously and reinforces the need for veterinarians and producers to work together on protocols to ensure that these products are used appropriately. In 2021, Guidance 263 specifically called on animal drug manufacturers like Zoetis to change medically important antimicrobial drugs from over-the-counter distribution channels to prescription distribution channels by June 11th, 2023. Prior to this guidance, we already had changed a variety of channel applications such that we were already providing veterinary oversight to 96% of antimicrobials used in animal agriculture. And this guidance gives us oversight on the last 4%.
So there's a number of antimicrobials that are covered by this guidance. Give us kind of a general overview of what we're looking at here, if you would.
Sure. So yeah, as you mentioned previously, there are 91 different animal health product applications affected by this change, manufactured by many different companies. Out of those 91, about 25% of those are Zoetis products. We will supply in the chat a link to the FDA website, which shows all of those impacted products, as was initially put out when the guidance was put in place. Some of the more common drugs that people will be used to seeing on livestock operations would be cefaclorin, erythromycin, gentamicin, which is a drug that has been actually both the AABP and the AVC, and I would bet the American Association of Swine Veterinarians as well has looked for ways to discourage producers from using gentamicin. So that's coming under prescription as well. Lincomycin, your penicillins, your tetracyclines, a number of sulfa drugs, all of those are on this list. Relative to Zoetis specifically, we have 6 commercially available products that are impacted. Albadry, which is a dry cow treatment, Albon boluses, which is a sulfa drug, injectable Lincomix, oxytetracycline, LA200, and then some topical applications of tetracycline as well.
So that link is there if you want to go on and check out all of the products that would be affected. Likewise, if you have any questions for Mike, be sure to post those over in the chat. Or if you're following us from social media, LinkedIn, Twitter, Facebook, you can feel free to post your comments right there in those social media channels, and we'll get to those. So now, Mike, leading up to June 11th, which is the deadline for this guidance and it goes into effect, how are animal health companies preparing for label and packaging changes? And what does this mean for producers that might be using these products?
Yeah, so we've had a long lead up to this conversation, quite frankly, with the FDA, and Zoetis has worked diligently with the FDA to get our label changes put in place. We have put all our required label changes to move from OTC distribution to prescription only in place, and they have been approved, so we are ready to go. That being said, all the manufacturers have a variety of drugs in inventory that's already been labeled, that's out there and available. Those drugs are fine for use and for sales and distribution as long as that inventory is still out there. So we will see a bit of a transition period. And certainly one question that has come up from producers and veterinarians as we've gone through this is, do we have to throw away product if it's not labeled appropriately after June 11th? And the answer to that question is no. If you have that product in your inventory on your shelf at your operation, it's perfectly good to be used until it hits its normal expiration date.
Can producers expect to see any significant changes in how they obtain products? We now have a veterinarian that has to be involved. What does that mean?
So yeah, I mean, obviously, first and foremost, what producers are going to need to obtain these drugs going forward is a prescription, and that has to be written by a licensed veterinarian. So producers need to have a veterinarian, right? They need to have a veterinary client-patient relationship or a VCPR in place with a veterinarian. And if they don't have access to a veterinarian now, it's a great time to start reaching out to other livestock producers in your area, state veterinary medical associations, other livestock associations, to make sure you can find a veterinarian and have that relationship and have those conversations and have that relationship in place. Once a prescription is written, however, producers still have a variety of options to be able to obtain those products. Certainly, they can get them directly from a veterinarian or a veterinary clinic that does that type of distribution. They can get them from a retailer as long as that retailer has set up in place to be able to handle the pharmacy issues associated with distribution of these drugs under prescription. Or they can work with a distributor. We have lots of drugs that are distributed, by big distributors directly to farm operations with a prescription written by a veterinarian. So those options are all still available for people.
Yeah, because we've heard a lot about the shortage of veterinarians. So making sure you have some kind of channel in place, I would expect to be a pretty important part of this process. And June 11th is coming fairly quickly. So we do actually have a question from one of our online viewers. So we're going to take that at this point. I think if you can, so they want to know if any water soluble products will be impacted at this time.
So we don't have water soluble products on that impact list, but I don't know everything that's on that list of 91. I would refer people again to that FDA website link that lists all the specific products. I would presume that a lot of the water soluble products that are out there, depending on the application that you're looking for, are already under some type of guidance based on the veterinary feed directive, which was put in place between 2015 and 2019.
So as we know, there's always confusion. There's always misunderstandings whenever we have a change in regulations or a change in anything. So what are some of the common misconceptions that you're hearing out there? What do folks really need to know and understand about the new guidance?
So I think what people really need to understand, right, is that you're not just going to be able to go to the farm store anymore and buy anything you want. You do need to have a veterinary client-patient relationship in place, which means that you've established a relationship with a veterinarian. They understand your operation and what types of opportunities and challenges you have in terms of your livestock facility, what types of diseases you face, and how you've typically managed them up to this point. Veterinarians, of course, have specialized training in disease diagnosis and treatment, as well as pharmacology, and they can provide some insights and knowledge as to how to best prevent disease and treat it when it arises. But now more than ever, it is really critical to establish a veterinary client-patient relationship and have it in place now, revisit treatment protocols now, so that when an issue arises, everything is ready to go. You can work with local veterinarians to identify disease management strategies And if you don't have a current veterinarian, I'll recommend, again, resources like state veterinary associations, cattlemen's associations, or other livestock associations, friends and neighbors and other people who are in the livestock industry that can help. The more of those conversations that we have up front, the more those relationships are in place, the more we have both treatment protocols as well as prevention protocols around vaccination, such that we don't even get to clinical disease, the better off we're all going to be. What we don't want to be, or what we don't want to have happen, is people have clinical disease and not have prepared for this situation, and then not be able to access the drugs they need to take care of their animals. We all want animals well taken care of through this entire process.
Right. When you have sick animals, it's not the time to go looking for a veterinarian so you can get something to treat them. You got to start, at least have something in place now. So great advice. Now, with the new regulation that puts these antibiotics under the guidance of a veterinarian, what is the impact a producer can expect on their herd health protocols? Is there anything that they will see that really needs to change? I know a veterinarian is going to be involved, but what are you thinking about in that regard?
So, number one is to have protocols, right? And if people already have pre-existing protocols that they've put in place with their existing veterinarian and under an existing VCPR, I don't expect those protocols to change at all. Hopefully, we're having good conversations about what treatment looks like, what disease looks like, and how to identify it appropriately. And veterinarians are being consulted when people have questions about things that don't look quite normal when an animal gets sick, such that we're intervening with the right treatment at the right time, right? Everybody has heard in the past that, viral diseases, antibiotics don't work against viral diseases. And so we need to make sure people understand those differences and that we're not misusing antibiotics in those cases. But pre-existing protocols, both for treatment as well as prevention, vaccine programs and the like, they shouldn't change very much. Now, if you haven't had a VCPR and you don't really have protocols either for treatment or vaccination, now is a great time to get to work with them. And veterinarians are very used to having those conversations.
So what is Zoetis specifically doing to help with this changeover from OTC to prescription only status?
Yeah, so as I said, we are really committed to make sure that animals are getting the care that they need through this process. And we're always advocating for animals and the people who take care of them, producers, veterinarians, and really all the rest of us in the livestock industry. So we've been working on this issue for a number of months. And we've been sharing this type of information, right? Whether it's through a format like this or through print publication formats, many of which we've done with you, to make sure that people have this information and that they know to become prepared, right? We've also worked with distribution channels and with retailers, resellers, veterinarians, any place where people can buy drugs now through the OTC chains. We have worked with those organizations to make sure that they are likewise prepared and know what changes are going to happen so that their organizations are ready when the time comes. For anybody who's interested, you can also find more information at www.zoetisus.com/FDA requirements. We have all of this information available at that site, and I'm sure that somebody can put that into the chat for our audience who has interest in that material.
We sure can. Thank you so much. A quick reminder here, if you have any questions as we look to wrap up here, now's your time to go ahead and post those. So, Mike, what else might our audience need to know about the pending changes? And you gave us some great places to go for information, but what do you want to leave them with today?
Well, I think the take-home message, and I think we've delivered it a number of times, right, is be prepared. Act now and start those conversations. So now is the time to talk with your veterinarian to avoid surprises about where and how you access animal health products when June 11th arrives. And now is also a great time to review full vaccine protocols with your veterinarian, because really prevention is the key to animal health. We want to prevent as much disease as possible so that we don't get to clinical disease. The best way to use antimicrobials judiciously is to not have a need. So be prepared.
And June 12th, like we said, it's coming fast. We
There's a
all
lot
know
of
it's
good-
going to be here. All of a sudden, we're going to flip that calendar. It's going to be June, and you don't want to be going, "Oh no, now what do I do?" Because I know I've got some changes coming in this month. So, our
Exactly.
thanks to you, Mike, for being with us today, Dr. Mike Lormore of Zoetis. Appreciate your time and your insight.
Thank you, Sue.
Thank you all for joining us here today. A reminder that all Feedstuffs 365 sessions are available in on demand at 365 at feedstuffs365.com, so you can view them at any time. Until then, for Feedstuffs and Feedstuffs 365, I'm Sarah Muirhead.